Second session, because there's a speaker and a video which we'll be showing of a person with MS who's actively involved in the program. Our speaker is Lucinda Black, Professor of Nutrition at Deakin University, and she's talking about a project looking at research into nutrition and diet and its relationship with MS. I don't know about you, but I was very influenced by George Jelinek's book and have followed a vegetarian diet and a low cholesterol diet for many years. In the belief that helped limit the progression of my MS. I don't know whether it did. I mean, I really have no way of knowing how things would have been if I didn't have that diet compared to how they've been as I do have that diet. And I suspect that's the situation regarding information about the relationship between diet and MS very, very widely. And so I'd be fascinated to listen to the presentation this morning about research into that connection. So I'll hand you over to Lucinda. Thank you.
So I've been working in nutrition research for about 20 years, or more than 20 years now, and for about 10 years specifically in MS. And my earlier research was in Perth. I was living there for 10 years, and I moved to Melbourne 2 years ago. So this work in MS it started in Perth and now is continuing here in Victoria. So I'll introduce the team that I work with, because I couldn't do all of this research on my own. And then I'll go back and give you a historical context about the role of diet in MS, because it does go back many decades, and some of that information is still pertinent today. And then I'll talk about diet and risk of MS. So that may not be relevant to people who already have MS, but rather be important for preventing MS in the first place. So that would be relevant for people who are at high risk of MS, say if you had a close relative with MS. And then I'll talk about diet and MS progression. And that's of course what people with MS are very interested about. As Nigel mentioned, there's lots of information online about diet and MS, and lots of very contradictory information, making it very confusing for people with MS to know what to do. And then I'll talk about Eating Well with MS, which is a nutrition education program that we've put together that's been co-designed with people with MS, and it's tailored for MS. Okay, so really important in our team is our stakeholder reference group, and we've worked with this group since 2019, and it consists of people with MS and MS health professionals, and they've helped guide the direction of the research program that we work with. And they help to provide feedback on the documents we create and all the design of our research. So community involvement is really important in all the research we do, and has been for many years. And we have just had absolutely brilliant input from the MS community, initially in WA when I was working in Perth, and now more recently here in Victoria, and you'll hear from Adolfo soon, who has been working with the team as well. And the 4 researchers across the top are working in my team as postdoc researchers, which means they all have a PhD. Some of them have a PhD in diet and MS, they all have a PhD in nutrition and are now working in diet and MS. And then along the bottom, there's 3 researchers, or 3 PhD students who are training in research. Grace and Georgia are in WA, and Edward has just started at Deakin, and he'll be helping with the education program. So there's a lot of people involved in some of the research I'll be talking about. Okay, so I'm going to take you back now to the 1950s and to some research by Roy Swank. And you may have heard of the Swank diet, still very popular today. It goes back many decades. So it goes back to what's known as ecological studies. So these are when researchers look at population level intakes of a nutrient and disease outcomes, but they're not looking at individual people and outcomes. So one of the earliest studies was across Europe in the 1950s, and Swank looked at the intake of dietary fat before, during, and after the war. So that graph there shows his work in Norway. And you can see in the top section there, the number of MS cases goes down quite a lot during the war. So did fat intake, it went down during the war. And so did milk production in Norway, it went down during the war. And then all of those things increased after the war. So this is a kind of study that's a correlation. Those things are correlated. And he saw that in other countries too. And this is where he thought that maybe saturated fat from dairy products was a problem in causing MS. But the thing is that this correlation type of study is not demonstrating a cause. It's not saying that milk or saturated fat was a cause of MS. And there were lots of things going on during the war at that time that would also be correlated with these various things. So it's an indicator, but certainly not causation. So also at the same time, he looked at, specifically in Norway, where in Norway was MS higher than other places. And he found that MS was more cases of MS inland, where there was dairy farming, and less cases at the coast. So he thought, okay, there's something going on with the dairy farming that is related to this higher cases. But also, of course, at the coast, you have more people eating fish that are compared with people inland. So a couple of things going on. And again, these are just correlations. So there's a lot of differences between people who live inland in Norway compared with the coast. We're not talking about cause here. But this did lead to him developing the swank diet, which actually in the 1950s was very different to the current swank diet. So if you follow his papers from 1950 to the 2000s, the diet changes over time. The diet today is not the same as the original diet. So there were other ecological studies done as well a little bit later. Another research group wanted to look further at the cow's milk information. So what they showed actually worldwide was a similar correlation between milk and cases of MS. But they actually dug a little bit deeper and they realized that it was mainly from people who were on dairy farms drinking unpasteurized cow's milk. And they thought, actually, maybe it's not saturated fat. Maybe it's something about the fact that there's other things in unpasteurized cow's milk, like what they termed it was metabolite, toxin, or virus in the unpasteurized cow's milk. And there was another study worldwide that was looking at processed meat and smoked meat. And we know typically that processed meat is not great for many health outcomes. And they showed that in various places in the world where there was more smoked meat consumption, there was more MS. But they also noted that in coastal areas where there was more fish consumption, there was less MS. So it may not be about smoked meat, it may be about fish, or again, it's just a correlation, not a causation. But that figure on the right, the dark black area at the bottom, is where there were most cow and dairy farms in Australia, and that's also where there were most MS cases. But again, we also know there's other reasons for that, like latitude. So we know Tasmania has higher MS cases probably because of the latitude. So what I'm trying to say is a lot of this older research, it wasn't about cause, and we can't take it as cause. But this research has influenced what we hear about on the internet. Okay, so now I'm going to talk about more recent studies in MS onset. So again, this is about risk of getting MS in the first place. And research overall in diet and MS has really taken off in the last 10 years. So it's come a long way from those historical studies that I mentioned. So I put together this figure to try and give you a kind of graphical overview of what's happening. It's not a comprehensive review of the literature. But these are some of the places in the world where there has been quite substantial research on diet and risk of MS. So our team is working with a study from Australia, and I'm collaborating with researchers in America and Canada, and then other groups in Europe and the Middle East have done research. So overall, what has been seen in these various populations around the world, very independent from each other, is that a higher Mediterranean diet has been linked to lower risk of MS. So a Mediterranean diet is high in fruit and veg, it includes nuts and seeds, legumes, olive oil. It allows meat, poultry and dairy in moderate amounts, and it's low are very low in ultra-processed foods, so all those highly processed foods that contain lots of industrial ingredients. So it's actually very similar to a typical healthy diet that the general population is advised to eat. But because we're seeing this around the world, there does seem to be something going on with diet and risk of MS. Fish is one of the most consistent things that is shown with lower risk of MS in many populations. And it doesn't have to be a lot of fish. I'm talking about a couple of serves a week, which is in line with what the general population are advised to eat. Some studies have shown higher fruit intake beneficial. Some studies have shown that yogurt and low-fat dairy is beneficial, so lower risk of MS. We showed in Australia that higher unprocessed red meat was linked to lower risk of MS, which is important and interesting because we know that young adult women in Australia typically don't eat enough red meat. It's older males who are eating too much red meat. But this hasn't been shown in other populations, but that's partly because it hasn't been studied elsewhere. And ultra-processed foods is starting to be quite a hot topic in MS and has been shown to be linked with higher risk of MS in various different population groups. And we have other studies that are unpublished that are showing a very similar pattern across the world. So it's important that we're seeing this in different populations because it really adds strength to the findings. But I will point out that all these studies, again, causation is not possible to define. Because it could be that, it could be a bidirectional association, and there could be other things involved in the links. So if you get a copy of these slides, all the references are there, but I will say that this isn't a comprehensive review. There are other studies, but this is the big kind of picture. So some researchers have collated the evidence on certain foods. So they've done what's considered a systematic review where they collate the evidence from similar studies. And so for fish, they found 6 studies had looked at fish, all showing an inverse association. So higher fish consumption, lower risk of MS. But again, only a couple of serves a week, not too much fish. Unfortunately, we have polluted the seas. We know fish contains mercury, so more is not necessarily better. And for fruit and veg consumption, the evidence is more mixed. They found 8 studies. Some showed no association, some showed a positive association. And there have been some studies looking at specific nutrients. Omega-3 polyunsaturated fatty acids has been of interest, and they are the fatty acids that are high in fish, especially oily fish. So you would get these from oily fish, and higher intake of those has been linked to lower risk of MS, and higher intake of alpha-linolenic acid and omega-3, which is in nuts and seeds mainly, also linked to lower risk of MS. And cod liver oil, which is high in omega-3, linked to lower risk of MS. And part of the original Swank diet actually included daily supplement of cod liver oil, but I'm not sure if that's in the diet anymore. So other nutrients have been studied in relation to risk of MS, but there's really nothing consistent going on, like saturated fat, no association, with salt, same thing, dietary fiber, no association. So the stronger evidence is around foods and diets. And these are the studies that our team at Deakin has access to that we are currently analysing for similar links. And interestingly, we have data from Brazil and Japan, which we are analysing at the moment. And that's really interesting because, of course, that's totally a different ethnic group, and we want to see what's happening with food and MS in those groups as well. So this is all underway at the moment. So there are many limitations to these dietary studies, and I just would like you to be aware of them. It's a very complicated thing to do. When you ask someone about their diet, has that stopped working? So when you ask someone about their diet, that brings up all sorts of problems, because if you ask them about what they've eaten over the last year, obviously it's going to be a very general overview of what they've eaten. And that's what happens usually in these studies. If you ask them everything they ate in the last 24 hours, it takes a long time, but you can get a good picture of what was eaten. But then that's just one day, and you might have had an unusual day. It doesn't represent what you ate generally. So these are parts of the issues that we have when we do diet research. And also people tend to forget some of the things they've eaten. They either actually forget it, or they just, they forget it because they had 2 Mars bars and they don't want to admit that, right? Or, they forget about the can of Coke they have, or they forget how much they ate, or they forget that they ate only half of their meal. So underreporting is an issue. So we might not be capturing truly what people are eating. The other issue when we look at these links is whether another factor is actually what's important. Like, could it be that people who eat fish are actually doing something else the same that's beneficial, and fish is just a proxy for something else? But we do try to account for all of that when we run the models, which is why we ask lots of questions that aren't about diet to see if there are other factors. An example could be smoking. I mean, smoking is a risk factor for MS. And is smoking linked to diet? Do people who have healthier diets smoke less? It's a possibility. So we do account for all of that. So the other thing is that we know that when people are diagnosed with MS, often they change their diet. So we need to be careful that we're capturing the diet before they got MS, not just after they got MS when they've changed their diet. Which brings me to timing of exposure, which is timing of diet. As you heard before from the previous speaker, MS probably starts many years before diagnosis. So just by capturing diet in the last year, that might not be the relevant diet. It could even be diet in childhood that is establishing a process that is not seen as a symptom yet. So we don't know at what point we need to capture diet. So there are some studies that ask what people ate in childhood. But again, recall is very difficult to remember what did I eat, 20, 30 years ago. And the other related issue is overweight and obesity, because there's potentially a link between overweight and obesity in MS, and diet affects obesity. So is it just that a healthy diet is linked to MS via obesity or body weight? We're not sure, and it's one of the things we're looking at. And there are many different mechanisms that could link diet and MS, so it is very feasible. We know that MS is an inflammatory process, and we can have anti-inflammatory compounds in the foods we eat. So if you're eating more of a healthy diet, it's higher in antioxidants, it improves the gut microbiome, which results in lower inflammation in the body. Same with omega-3s. And also within omega-3s, they're very important as a structural component in the brain. So it's not just about inflammation, it's about the structure of our cells. For unprocessed red meat, we know it's the best source of iron, bioavailable iron, as heme iron. It's well used by the body. And young adult women are often iron deficient. And potentially that's why they have higher requirements for unprocessed red meat. And for ultra-processed foods, they disrupt the gut microbiome, causing a pro-inflammatory environment. There are actually contaminants in processed foods from the packaging, from plastics they're wrapped in, and also from the processing of the food itself. And of course, if you eat more ultra-processed foods, then you are eating fewer healthy foods. And in Australia, we get about half of our energy intake from ultra-processed foods, and it should be less than 10%. And so these foods can be kind of packaged foods, they're pastries, and some of the very highly processed breads, there's some of the very highly processed breakfast cereals, even things like muesli bars can be considered ultra-processed. And we're eating a lot of them as a population. Okay, so I'm going to move on now to talk about diet and MS progression. So this stuff is more relevant to people with MS, but it may be that some of the factors that are associated with risk are also associated with progression. And I just want to start by mentioning the special diets for MS, because of course many people are interested in those and they are promoted to people with MS. So I've tried to just put them in a table that's easy to understand. So there's the Swank diet, overcoming MS. The McDougall is a vegan diet. The Walls diet is a type of paleo diet. And at the bottom there is the Australian Dietary Guidelines. So you can see clearly from this table that all of these diets are saying fruit and veg, good. Let's eat more fruit and veg. the Australian Dietary Guidelines and the special diets. And if you look at the back of the table, ultra-processed foods, UPFs, all of these diets are saying, let's not eat them, let's eat less of them. So that could be really key, because anecdotally, I do hear people say, I feel better on the SWANK diet, the Overcoming MS diet, Wall's diet, whatever. They feel better. And it could be that, you know, all these diets suggest more fruit and veg and lower ultra-processed foods. That's a big change for most people. In Australia, only about 4% of the population actually eat enough fruit and veg according to the guidelines. 96% of us could be doing better. So already, those things are big changes. So what I'm particularly interested in is the middle of the table. So meat, okay on some of these diets, not on others. Poultry, eggs, dairy, lots of different recommendations going on. But you can see that the Australian Dietary Guidelines is the most permissive. And that's important as well, because restricting food groups is stressful for many people. Say if you like cheese and you think you need to stop eating dairy, that can be quite stressful for people. So what we want to know is whether that's important or not for people with MS. And a lot of the research is now focused, at least in our team, on trying to answer those questions for people with MS. Because those food groups are nutritious. And if they're okay to eat, let's eat them. If they are deleterious for MS, I agree, avoid them. What we want to know is what the evidence is showing us. So unfortunately don't have loads of answers for you today, because it's all work in progress. But that website there, it's an MS Australia document. It's a modifiable lifestyle guide that I was part of the development of that in 2020. It's available for download, and part of that discusses diet for people with MS. And we've actually just updated that, and there'll be a new version released this year. But these are some of the points that were made in that guideline. So overall, there are very few studies that have looked at diet and MS progression, partly because it's very difficult to assess. And when they have been conducted, they do have some problems. And because of that, we can't rely on them to say, yes, there's a conclusive answer now that we should or shouldn't avoid a food. So the Mediterranean diet, it has been shown to be linked to lower risk of disability and symptoms, but this was a cross-sectional study. And what that means is they were asked about their diet and their symptoms at the same time. But it could be that people who have more disability are less likely to follow a Mediterranean diet, because they don't have time to go shopping for these foods and chopping foods and preparing all these Mediterranean type foods or these healthy type meals. So any cross-sectional study is not causal. We can't say one thing causes another. The Wall's diet, Terry Walls herself has led and funded some studies, and she has had funding from some US funding bodies to run some trials, and shown that her diet was linked with lower fatigue and improved quality of life. But there were very small numbers in the studies. Some of the studies included exercise, meditation, all sorts of other things, so it might not be anything to do with the diet. There's also obviously a potential bias when you have someone funding the study who is invested in the diet being studied. For the low saturated fat diets, which covers SWANK, Overcoming MS and McDougall, again, some studies have shown links with lower fatigue and improved quality of life, but again, small numbers in those trials. Not enough people to say conclusively that it's beneficial. Intermittent fasting has been looked at, and it was shown to improve weight loss for people who needed to lose weight, and again, improved quality of life, but small numbers and very hard to follow that diet in the long term. A dairy-free diet, very inconsistent findings. One study showed that higher dairy was a problem for people with MS, but only when it was excess. So really eating far too much, more than, say, the dietary guidelines. And some of these studies, again, have potential for bias when they are led or funded by researchers who are invested in the diets being studied. That's a picture there of the current lifestyle guide. You can find it online, MS Australia, and download that. And as I mentioned, there'll be a new one shortly. So fish consumption has been linked with lower disability in people with MS and better quality of life. But again, the same problems, cross-sectional studies, potential bias, and it's the same for all of these factors here. They are cross-sectional, so we can't infer causation. Coffee consumption, very mixed, could be linked with lower disability. Another study found no association. Alcohol, very mixed findings again. And sodium intake, mixed findings, could be no association, could be better quality of life. So overall, none of these studies yet can really give us any conclusive answers. So one of the projects I'm working on at the moment is a longitudinal study, which means they have followed, and I'm working with people in UTAS who run this study in Tasmania. They have followed people with MS for 15 years. So we have their information on diet at baseline when they were recruited at 5, 10, and 15 years. So we know what they were eating each of those 5 years, and we know their outcomes, their clinical outcomes. So this is a stronger design than a cross-sectional study, because we can see how diet and the disease progresses over time. It's very complicated to analyse, but we have happily had funding from the US to do this work. So we're looking at various diet predictors, the ones I've shown you before, because we want to look at those factors longitudinally with outcomes in people with MS. So hopefully later this year, early next year, we'll be publishing some findings from that study. So currently, because we don't have conclusive evidence from any of these studies, the recommendations from MS organisations and in general are to follow the same guidelines as the general population. And as I explained before, that's not what we're eating. Typically, we're not eating those healthy, the Australian dietary guidelines. So actually moving towards those guidelines is a big change in diet for most people. So I've just listed briefly some of the guidelines, which are more fruit and veg, choosing whole grains over the refined grains, including lean meats and poultry and fish and eggs or their alternatives. And because of the research around fish, I would suggest a couple of serves of fish weekly, ideally oily fish, which is salmon, sardines, mackerel, tuna, for example. So, and limiting intakes of the ultra-processed foods or the junk or discretionary foods, which we typically all eat too much of. So if you go to eatforhealth.gov.au, they have some very easy to follow resources, and which are for the general population, but also applicable to people who have MS. So talking now about recommendations, I'll just briefly go over the nutrition education we've put together. So I've worked with Rebecca for many years. She's based at Curtin, and she did a PhD in diet and MS, and she went out and talked to people with MS about diet. And what she learned was that they actually weren't really given any dietary advice, even though there's so much interest in diet by people with MS. And what they actually asked for was they wanted diet education that was tailored to people with MS. They didn't actually want to be told what I just said, which is follow the Australian dietary guidelines, right? They wanted something more specific. Because often what they were told was, oh, just follow a healthy diet. But then they went away thinking, well, what is that? And look at all this information online. Maybe it's not the Australian dietary guidelines. It could be something else. So what we've done is put together an online education program called Eating Well with MS. It's a 6-week program, so it's about 1 hour per module, and it's very behaviour change focused. So it helps you set goals. There's a discussion board where you can chat to other people doing the program, and there are activities and activity book to help you change your behaviour. Because we know that just giving people information or knowledge about diet, it's not the same as helping them change behaviour. It's actually quite hard to change your diet. And we just had brilliant input from the MS community. We had lots of interviews. That's Amanda being interviewed there. She's a person with MS. So yeah, the education program includes lots of interviews with experts, and we include people with MS as experts of their lived experience. So they talk about how they deal with some of the issues like fatigue and preparing meals, and there are lots of tips to help people have just ideas to help manage their symptoms with diet. So what we've done is we've run that as a small pilot study. It was mainly with people with MS in WA. So we had 70 people do the program. And based on that, we've improved the program, and we will be running it again as a much larger trial early next year, probably recruiting later this year. And we aim to recruit about 300 people with MS, and half of them will do this program straight away, and the other half will do the program later. So we need to do that to make sure that we have a control group, so we can see how effective this program is for helping people make positive dietary changes. But overall, everyone will do the program at the end, and the aim is then to get this program freely available to people with MS in Australia, and there's been a lot of interest globally as well, so in other countries around the world too, because it's co-designed with people with MS. So we've listened to them, we've included the content that people with MS want, and it's tailored to specific symptoms and challenges of people with MS. And then in the future, we want to design a similar program, but for health professionals, because we've heard from nurses that they just don't know what to tell people about diet, and they're asked all the time, they don't know if they should be recommending overcoming MS or SWANK or what. So we also want to develop a program for health professionals. So I've mentioned I have a brilliant team working on all of this research, and as well as the fantastic MS community that gets involved in our research, I also have many national and international collaborators. And these people have very generously provided data from their studies where they've collected information on diet, so that we're able to actually analyse those and get some more answers. So as the research and evidence develops, that will be incorporated into our education program. So hopefully eventually we'll have more conclusive evidence that's specific to MS. And the project's been funded over the years by MSWA, by MS Australia, and recently by the National MS Society for various aspects of the research that we do. So there's a QR code there to our website, and you can contact us at that email there, or me personally at Deakin. And there's some flyers at the front. It's a community update from late last year, which also has our contact details on. So that's my presentation for you, and I'm happy to take questions now or after we hear from Adolfo. I will leave it up to Nigel to coordinate.
Well, you might like to take some questions while I set up.
Oh, sure. Good to go.
Oh, you got me to go? Thank you very much. Thank you very much. I've got the sticker Elvis here. I'm sorry I was late today. It just took him a while to widen the door to let my halo through, so that's why I'm a bit late. And I was going to sing for you. Now, I was thinking, we don't eat our orange peels, we don't eat our apple pips, we don't eat our lemons. Well, I eat all of those, and I've had MS since, 96 I was diagnosed, but probably had it since 86. But I don't know if that's why I'm doing so well, because, eating lemons, eating pips of apples with arsenic in it, is not enough to kill us, but it's enough to kill what's killing us. So I'm doing something right. I don't know what it is. Maybe it's singing. I do a bit of singing. So I think stress. I bought a book called When the Body Says No, The Cost of Hidden Stress. And the first 3 chapters are about people with MS. So stress is a big factor. So if you can do something like sing or listen to soothing singing or something, it's a big factor, not having stress.
Yeah, I agree with you. The stress is a problem, and that's actually one of the reasons why we don't want people to get stressed about their diet. And when you Google diet and MS, I mean, it's stressful for me to look at the information, so I can only imagine how stressful it is for people to be faced with all that information, and it contradicts each other. And we're trying to take the stress out of diet for people. But in terms of eating the pips of lemons and apples, I actually can't answer that, so I'm not sure, but if it's working for you, I can't comment on that.
Okay.
So the question for the recording was, does the length of time that you've had MS impact on your diet?
Yes, I was diagnosed in 1962. Now, I don't think my diet has changed over the years since then. Would be the fact that I lived in the country for a while and had a lot of milk and other dairy products, but also I did have a wide variety of vegetables. the family had meat and 3 veg. That was the type of food that I had during my lifetime.
So the question is about that you've had MS for a very long time.
Yeah.
You're not sure what caused it, as we understand we don't know exactly what the cause of MS is. But the fact that you've had it for a long time, it wouldn't necessarily impact on how diet affects your MS now. So in our studies, we would include people with MS who have had it for many lengths of time.
Yeah.
And we're looking at all of that. Because the process once you have MS in your body is probably similar whether you've had it a long time or not. It's changing over time. But we include all people who've had MS for lots of lengths of time in our studies. Yeah.
Also, I'm a 3rd generation person with MS.
So you also have a family history of MS, I understand.
Correct.
Yes.
Thank you.
Which is a big risk factor, yes.
You mentioned about the Deakin University in Western Australia and Rebecca. And actually I'm involved in her research now as well with her about setting up exactly kind of the same recommendation. So I'm still, in my opinion, it is a little bit confusing if you pop in with one idea and they pop in with other idea, and will be again in the internet will be flowing too many different recommendations, which is, in my opinion, is more stressful actually for people with MS than less, which is, again, as we mentioned, is not good for us to be stressed. So I think still it's worth to be make like one or consistent recommendation, like combine whatever that both programs somehow or something like that, I think. Because in modern era, we are bombarded with so many diets, exactly. We've got thousands of different diets. It is kind of killing. And just keep it simple, always working better than different diets. But anyway, so I still strongly kind of would like ask you and to cooperate together and make it easier for us to follow. Maybe some people can handle that, digging in the information, some liking that stuff, but most people, I think, in modern day don't have time. They want to know something good and start maybe doing that program. And maybe one more recommendation in this program about the diet. Now we've got a lot of companies who deliver the food, yeah, ready cooked food, yes. And actually, some of them are doing crappy job, but some of them are doing very good job. And it could be good to maybe introduce that kind of food, that kind of at least 1 meal per day or something made this from this pre-packaging food, but it still is not processed. It's cooked by cooks, and it's only packed by, and that's it. So I think it's make the people easier to have more, a little bit veggies at least, or some healthy foods as well, which is hard to cook at home.
Yeah, so Rebecca is actually part of my team. We're all on the same team. So this program is the same one that Rebecca,
okay.
It's all the same program. Yeah, so because I was at Curtin, and then I moved to Deakin 2 years ago. The team is spread across Curtin and Deakin, but there's just the one education program, so that's good, yeah.
Okay.
And Rebecca is working with other researchers in WA on a project to provide meal boxes. So to provide healthy meal boxes to people with MS. And that's in its early stages in WA, and if successful as a small study, we would seek funding more nationally.
Oh, it's very good, yeah.
Yes, to roll that out,
yeah.
say, here as well in Victoria. Yeah.
Yeah, thank you.
Hi. You're probably not going to be able to answer this causally, but if the indication is that fish is good for MS, is taking fish oil supplements equally as good?
Well, so the taking of fish oil supplements and eating fish, they are two different things, because there are other things in fish that are important, like protein, for example, and fish contains vitamin D. So one is not a substitute for the other, but it may be that omega-3 as a supplement is important. But the research, so far, it's not conclusive. There have only been small studies, and some of them have shown no effect, and some of them have shown some benefits. But overall, there's no conclusive evidence to say that people with MS should take omega-3 supplements. So what I would suggest is talk to your GP or your neurologist about it, because omega-3 supplements can interact with other medication. So you want to be sure that there's any supplements you take aren't doing that. But if you're interested in taking them, you could certainly bring that up with your healthcare professional, your GP or your neurologist. or to see an MS dietitian or any dietitian about that who could help you make sure that you're adding supplements safely.
Can I just ask one question, please, regarding carbohydrate intake? Do you have any thoughts or comments on that as to what is an acceptable level?
So the question is about carbohydrates, and that is really interesting because, look, there are three main macronutrients: protein, carbohydrate, and fat. And these have not been researched very well yet in MS. But something we want to do, which we're working on now, is to look. It's a geometric way of looking at nutrition, where you look at the ratios of carbohydrate, fat, and protein to try and find out what is an optimal ratio. So we're looking at this now in relation to MS, because our body does need protein, and our bodies try to keep our protein intake at a certain level. And if we're not getting it, we will actually eat more of the other macronutrients in an attempt. So we'll eat more carbohydrates, hoping we'll get some protein from there. So there's a lot of metabolic things going on with these three macronutrients. And I don't have the answer to your question yet about how much we should be, or people with MS should have, in terms of ratio of protein, carb, and fat. But it's a very interesting question and novel, so thank you for bringing it up. At the moment, all I can say is current recommendations are same as the general population and with the Australian Dietary Guidelines, but we are definitely looking at that. Yeah.
Thank you.
One more question?
Is there any research using creatine in MS?
So the question was, is there any research using creatine in MS? I do believe there is, and there's a website that lists all the clinical trials that are happening in all different diseases, and including in MS. And if you look at diet and MS in that register, I think it's clinicaltrials.gov.au, but don't quote me on that, it's something similar. It will list all the trials that are being done. It's amazing how many trials are being done. All sorts of different nutrients, different supplements, and I believe creatine is one of those. And lots of other things like alpha lipoic acid, short chain fatty acids, lots of things. But as far as I know, I don't know of any outcomes yet specifically about that.
Hello, I'm Adolfo from People with MS Victoria. This presentation was produced for our 2025 Living with MS conference. Let's begin with an acknowledgement of country. We acknowledge the Wurundjeri Woi Wurrung people as the traditional owners of the land on which we live and work. We honour their enduring connection to land, water and community, paying respect to elders past, present and emerging. Hello everyone, my talk today is about an exciting project with great potential to benefit people with multiple sclerosis. We've collaborated in a study with the nutrition researchers Dr. Barbara Rayner from Deakin University in Melbourne and Dr. Rebecca Russell from Curtin University in Perth, Western Australia. Their study referenced the earlier 2016 study by Dr. Jeffrey Beckett and Dr. Kiran Ahuja from the University of Tasmania. The study seeks to better understand the dietary recommendations found on the public internet websites so that researchers can improve nutrition interventions for people with multiple sclerosis. Let's see the context first before we go on. Here are a few things to think about. We know that a person's health is strongly affected by the nutrition. A person's food intake can be influenced by what they hear or read. Technology today is everywhere, and information and misinformation is more accessible than in the past on people's smartphone or computer screens directly. So in this scoping and review study, we look at what MS-related dietary advice shows up when searching the public internet. We have a few questions, namely, have online recommendations changed from those of the 2016 internet search study? What's the reasoning behind that advice, and what sources, scientific or otherwise, if any, were used to justify such advice? To answer these questions, Drs. Brainer and Russell enlisted 3 people with MS, including myself, to collect and process the data. We collected data from website articles including advice reasoning, the qualifications of the author or the editor, and references to the sources used to write those articles. Using our insight as people with lived experience of MS, our role in the study was to capture the first 2 pages of search results, which is about 20 to 25 website addresses, and we then analysed the collected data using the same criteria as the original 2016 study. Now, just to clarify, without being too technical, a scoping review is a type of research mapping existing scientific papers to certain criteria. And in this project, we mapped the dietary advice for people with MS as found on the publicly accessible internet. Then we compare and contrast it with the 2016 study to determine the differences and report the results. By the way, if you wish to read the original 2016 study, it was republished in 2019 on the PubMed site to enable public access and download. The address is shown in the slide. I will have the slide available for you to download on our website. The processes used to collect the data are summarised in a table shown in that publication, and you can see it here. It's figure 1 on that paper. Why conduct a new study, you may ask? Well, we do know that many people with MS and or their carers actively search how to manage their MS symptoms. We, however, know less of the range, scope and quality of that advice that's served up in a search. So, knowing that Drs. Beckett and Ahuja at that moment in time referred to the fact that there is currently no scientific evidence supporting the use of specific diets in the management of multiple sclerosis, and despite the inconclusive evidence, most websites suggest disease progression and relapses in MS can be improved with diet, as well as past research indicating that the strongest dietary intake association of MS symptom improvement was actually only correlated with vitamin D and omega-3 fat intake. There were nevertheless many websites aimed at people with MS which provide advice or suggestions about what foods to include or to avoid. So what health advice value were these websites really providing? What are the 2024 study researchers interested to know? Well, essentially, it's that given there's been considerable progress in dietary research over the last 8 years, has any of this new information actually been reflected in the 2024 online advice? Well, before commenting on the preliminary results of that 2024 study, let's first take a very quick look at important features of the design. Online nutrition advice for people with MS was captured only over a few weeks in July 2024. The search process used 5 specific word associations, such as MS diet or foods for MS. Only the Google search engine was used. That's the google.com address page. We captured and saved only the first 2 standard computer screen pages of links for each search term result. Each link's page was stored as a file for data validation, and the content of each link was extracted, organised in tables, and finally analysed. Our team of 3 was tasked with selecting 5 short search terms. These search terms we deemed, as people with MS, we were likely to use to search the words such as MS diet, foods for MS, foods to avoid, anti-inflammatory diet and fatigue diet. Also, only the Google Chrome internet browser was used, and only in private mode, because this would stop the browsing history from being stored onto the computer and they're affecting by the results of the subsequent searches. Our team's involvement in this research was based on our backgrounds and lived experiences, and in my case, a metabolic syndrome diagnosis a few years ago led to an interest in exploring foods to improve my health, and I had a relevant information technology experience. In other words, the research team seeks answers to questions such as, what's changed in advice since 2016? How credible is that advice with respect to accuracy and completeness? Is advice validated by the evidence-based nutrition science? So now we're in the process of comparing the advice from 2024 to that of 2016. So how are the two studies, 2016 and 24, different? Well, the data set is larger in 2024, but better targeted by Google's 90% share of internet searches. And the search terms are better, perhaps, informed due to our lived experiences with MS. My experience in this project was that the amount of content analysis work involved was substantially greater than we first estimated. Here I can confirm some preliminary conclusions. From a personal perspective, participating in this project has highlighted the unsatisfactory level of accurate nutrition information currently available through web searches alone, and that we need to improve the communication and access to high quality nutrition. In conclusion, I wish to thank Beck, Barbara, Michelle and Harpreet for their collaborative work ethics and professional courtesy. I thoroughly enjoyed working with them and during the various phases of this project, and I do strongly encourage others with MS to participate in future research projects, as our contributions will help not only ourselves but future generations to better manage the multiple sclerosis condition. Again, from a personal point of view and being informed by my wider nutrition science reading over the last few years, I guess, I've realised that to improve a person's overall health through dietary intervention, we must be guided by better, well-founded, evidence-based understanding of the actual metabolic processes. And if you're interested in further reading, I've listed a few references in the description section below, in the YouTube video description part. Thank you for listening, and please consider donating, if you can, to People with MS Victoria. We are a registered tax-deductible charity, and it will help us to continue providing our services into the future.